Good afternoon. I'd like to welcome you to our daily COVID-19 update for the town of Plymouth. This is number 32, coming to you live on Monday, April 27. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon's channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today, we're joined once again by Kenneth Tavares, Chair of the Board of Selectmen, Matthew Muratore, our Plymouth State Representative. Also, Chris DiBona, he is with Brewster Ambulance. Karen Keane, she's the Director of Public Health for the town of Plymouth. Sarah Cloud, the Director of Behavioral Health for Beth Israel Deaconess. Lee Filson is the Executive Director for Seed Plymouth, and Amy Naples, the Executive Director of Plymouth Area Chamber of Commerce. And we're going to get right to the Chair of the Board of Selectmen, Ken Tavares. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. Two items I'd like to go over with the public today, and one is the mask order that's been put forth by the Board of Health. I want to make sure that I make it perfectly clear that this is an order of the Board of Health and will be discussed at the Selectmen's meeting tomorrow night, only in regards to one section of it, Section F, which requires proper disposal of gloves, facial coverings, and other personal protection equipment. Only the Board of Selectmen can impose a fine, and that's the only section that we will be discussing tomorrow. The board does not have authority to override the order that the Board of Health has put forth. So we won't be taking any questions in regards to that, except as it pertains to the fine that is being proposed by the Board of Health, but must be acted upon by the Board of Selectmen. Also, I would like to remind the public that taxes are payable May 1st, but if you so desire, there's an extension for vehicle excise, personal property, real estate, the boat excise, and the water and sewer bills that are due about mid-month. If these bills are paid before June 29th, on June 29th or sooner, they will not incur any additional interest charges or penalty. So if you wish to pay your taxes on time, it will be extremely helpful to the town as it figures out its budget for the remainder of the fiscal year. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. Each day we date stamp our forum so that you know that it's coming live. We hope to provide you with verified information from trusted sources, from officials, and from experts in the field. We also receive an update from BID Plymouth, which is our local hospital. And today's update says, in pertinent part, at Beth Israel Deaconess, we've made necessary changes to our care delivery in response to COVID-19 and the increasing numbers of patients presenting to the hospital who are testing positive for COVID-19. I'm going to continue to read these throughout today's program, but I do want to draw to your attention before our next speaker. We work in partnership with area first responders and the town of Plymouth on current COVID-19 procedures and best practices at the hospital. We're all working together to reduce COVID-19 exposures and to ensure the health and safety of the communities we serve. Our next guest that we welcome is Chris DiBona. Chris is the Director of Clinical Performance for Brewster Ambulance. He's joined us, but he's joining us by phone. So Chris, welcome, and what do you have to tell us about your responses to the coronavirus?
Yeah, thank you, everyone, and good afternoon. At Brewster Ambulance Service, we developed what we call our infectious disease unit and put that in place in early January. What we've been doing was monitoring, medical traffic and procedures and increasing of cases from Wuhan and also Italy. So we developed an aggressive posture early to be ahead of it. And that posture includes clinicians, physicians, quality assurance folks to monitor every case that comes into our system. And the monitoring includes not only, health and safety for the patients, but health and safety of our workforce and our team. So early on, the use of masks and gloves and personal protection equipment was imperative to us to be able to handle the calls as we knew they were going to ramp up. Those crews have been tremendously busy, and with our partnerships with the towns and with the hospital, the energy and the synergy has been very good. Our workforce has been diligent of self-monitoring for temperatures as well as sickness, and they don't come into work when they're sick to make sure that we keep our patients as healthy as we can. Additional screening that we have is when folks call 911. There's a couple of different procedures that we put in place. There's a caller interrogation that would indicate, that the patient, is in need of personal protection equipment to keep our crews safe. And we've also changed some of our procedures where crews may meet those patients if they're able to ambulate at the door. So if they can walk to the door and communicate, it gives us a good sense of safety in keeping those first responders on police and fire, safe and away from this virus. One thing to add, for the general community is the cleanliness of this. It's absolutely imperative that we don't let our guard down. And I know that this psychological impact of this over the last couple of months has been incredible for folks, but we can't get complacent. We're getting into a, pretty significant wave of sickness. So make sure that, hygiene around your home, cleaning surfaces, cleaning your shoes prior to entry of your home. And if you do need to get out and hit the supermarkets, please exercise as much protection with masks and eye protection and gloves as you can. Hand sanitizer is a huge help when you're unable to, get to a sink and wash your hands. But please try to wash them for 20 or 30 seconds and, concentrate on that social distancing. We understand everybody's getting antsy. There are good weather days that are coming up. I think that's brightening up, people in the community. But please keep aware that folks can be without symptoms and still pass along the virus.
Thank you, Chris. And that's Chris DiBona.
Thank you very much.
And he is from Brewster Ambulance. Chris and the other members of our panel will be available today to answer your questions. And Beth Israel Deaconess tells us also that they continue to proactively manage the current surge of COVID-19 patients. They have an incident command team, nursing directors, and medical staff that routinely revise and review patient surge plans, which includes bed usage, equipment, supplies, and staffing in order to meet the needs as the crisis evolves. And this daily preparation allows them to be prepared to handle future patient service surges. And with that, we're now going to go to Karen Keane. Karen is the Director of Public Health in the town of Plymouth. Welcome, Karen.
Thanks so much, Steve. So I have several items I wanted to talk about today. The first item is masks. Ken Tavares mentioned that the Board of Health has recently issued an order. It takes effect Wednesday morning, April 29th, which is requiring people to wear masks when they're in public and when they enter any building that's deemed essential. What I want people to know is it doesn't have to be an N95 respiratory mask. It can be a scarf like I'm wearing, as long as it covers your nose and your mouth. It can be bandanas that you may have around your house that you can also utilize those. It can be a mask of this type, or it can be a mask that you can follow a YouTube video with for material that you may have around your house. The important things to remember are that they should be made of material that's washable, so they can be washed daily, and they must cover your nose and your mouth. Now, people may say, well, we've heard that wearing a mask doesn't make a difference. It does make a difference, and I'm going to explain a little bit why it does make a difference. my mask that I wear protects the people that I am talking to or seeing. The mask that you wear is going to protect me. Without a mask, cough or sneezes travel farther, more germs are released in the air and onto surfaces, and more people could be exposed and be sick. If you wear a mask, your cough and your sneeze is contained, fewer germs are released, and more people are protected. Even if you don't have symptoms, masks are important in order to reduce the spread of COVID-19. So I just wanted to let folks know it doesn't necessarily have to be one of the high level N95 respiratory masks. It can be a mask that's at least covering your nose and your mouth so it protects the spread of the virus. On to my next subject, which would be our cases for today in Plymouth. As of last night, we had 177 cases confirmed positive, of which 136 still remain in isolation. And I want to talk a little bit about that today because that number is in direct correspondence to the fact that Plymouth is now using what's called the Contact Tracing Collaborative, working with Partners in Health. They are taking the majority of our caseload and doing the contact tracing for those cases. So moving forward, for those of you who actually look at the numbers every day on the Plymouth website, you're not going to see the number in isolation any longer because it doesn't really make sense. You'll still continue to see the number of the confirmed positive and the number of deaths that we've had. But the number of isolation, I believe, is just a little misleading because what's happening is with the Contract Tracing Collaborative, they're going to wait until the case, they'll own the case from start to finish. Once the case is finished, then that information will be sent back through me then, and the town will have access to that information. So I'll continue to post numbers as we get them from the Contract Tracing Collaborative, but it doesn't make any sense to keep posting that in isolation number right now. So for those of us who do follow those numbers, you're going to see that the isolation number is going to disappear for a little bit, but it'll be brought back once we start getting that information from the collaborative. Let's see, nursing homes. I want to remind everyone that our nursing home has a family resource line for all nursing homes. It's 617-660-5399. We had many facilities test over the weekend with the help of the National Guard. So I want people to be aware that because such a great number of testing was done, we might see, hopefully we don't, but we might see a spike in our numbers for positive confirmed cases because so many people were indeed tested. The results will be given to the facility, hopefully between 24 and 48 hours. So they're testing both residents and staff. So other things that we wanted to talk about today, gloves. I know that we've talked about, are we going to make gloves mandatory? And we're not at this point going to make gloves mandatory. We are going to encourage people to wear gloves when cleaning and disinfecting your home as in a protective measure for COVID-19. And also, of course, healthcare workers, when treating someone who is suspected or confirmed with COVID-19, should also be wearing gloves. I am also going to mention Boy, if anyone has used this yet or not, but it is a free online symptom checker. So you could actually go online to www.boy, and that's BUOY.com/mass, MASS. And it's very user friendly. And you put in the symptoms that you're feeling, and it tells you if it believes that you should reach out to your personal care provider because they feel that you have symptoms that may be related to COVID-19. So that's a free service, and that's something that anyone could use and have access to. I also want to talk a little bit about as we move into the warmer weather, people have asked questions about pools. There are three types of pools that you can have in the town of Plymouth: private, semi public, and public pools. Private pools are pools that are in your backyard. Those can be open and can be utilized. Semi public and public pools are pools that are open to the public. We find those in apartment complexes, condo complexes, hotels. Those right now are not scheduled to be open. We'll have to wait for further instruction from the state before we can go and open up any of those pools. Let's see. And finally, I want to encourage everyone to give blood. There is still a need from the American Red Cross for blood donors. So anyone who is healthy and can give blood, I encourage to do so. And to thank everyone for their efforts. I know it's difficult. It's we're in this now for several weeks, but thank you for your efforts with social distancing, and thank you for your efforts moving forward with wearing masks. If everyone does their part, we could really stop the spread and keep lots of more people from becoming sick. So thank you very much for everyone for trying so hard.
Thank you. That's Karen Keane. She's the Director of Public Health for the town of Plymouth. You can send her and all of our panel your questions to plymouthinfo@pactv.org. Beth Israel Deaconess Hospital has a peer support network, and it consists of a team of social workers, clinical and non-clinical wellness staff, and they offer behavioral health programs and support for all employees as they enter week 7 of the COVID-19 crisis. And the support includes 6 places of peace for staff to relax, meditate, and recharge. It also includes daily rounding with staff to check in with them and assigning peer support team members as a resource to each department. And today, again, we're welcoming Sarah Cloud, who is the Director of Behavioral Health for Beth Israel Deaconess. And I just want to mention before we go to Sarah that, as you've heard from some of the statistics, many people are affected by the coronavirus, and these people have names. In many cases, we're not able to share the information. This morning, I did receive a call from a local family member whose mother passed away from the coronavirus complications along with pneumonia, and he did authorize me to release the information. So I'd like to remember the family of Barbara Axford, who was a longtime Plymouth resident who died in the past few days from the coronavirus. She is survived by her 3 children, Gary Axford, Lynn Peterson, and Lori Axford. And we want to remember them and all of the families that are affected by the coronavirus. Gary reports that because their mother was in a local residential community, they've not seen her for the past 2 months, and they're not able to have a wake or a funeral. So that's a lead-in really to Sarah, who had already planned to talk about grief in connection with the coronavirus. So Sarah, thank you for coming back and joining us and giving us such important support at this time. Sarah.
Thank you. Thank you for having me. And my condolences go out to the family and everyone that's been impacted by the epidemic. I'd like to take this time this morning, the short time that we have together, to really expand upon the psychological impact that Chris mentioned earlier in the show. So we've been really experiencing a range of emotions, and as the pandemic continues, our feelings are changing, they're shifting, and they're evolving. And sometimes they're even sneaking up on us. So we experience gratitude for the frontline workers. We experience appreciation for the sunny days that we get to go outside. We experience love and reconnecting over family dinners, but we also experience a lot of anxiety and stress, sadness, fear, irritability, and even at times anger. I'd like to suggest that the underlying universal feeling of distress and the cycling emotions we're all experiencing at this time is actually grief. And it is my hope that if we're able to name this underlying feeling of grief, it will help us better understand it, help us better recognize it in ourselves as well as in others, and help us manage and ultimately find meaning in it. So to better understand the grief, it is helpful to use the framework of Elisabeth Kubler-Ross, who's so well known for her work in grief and loss, and her 5 stages of grief, which include denial, anger, bargaining, sadness, and acceptance. So here's how these stages apply to the pandemic. Denial. An example would be this virus is being blown way out of proportion. Anger. My livelihood is being affected, and all people care about is whether we wear masks. Bargaining. Okay, if everyone physically distances for the next couple of weeks, we can reopen, right? Sadness. They're talking about another round of infection in the fall. Will this ever end? And then ultimately, acceptance. This is happening. I have to figure it out. We'll get through it. So the stages of grief are not linear in process. They're actually, we can cycle through them and come back around, and we don't necessarily experiencing them in this exact order. So it's really, especially now that in this pandemic state, in that we don't know when the danger is going to subside. But it's really important to note that acceptance is where the power lies. That is because we have some control in that stage. An example of this could be, I can wear a mask in public, I can wash my hands, and I can learn how to stay connected with people through Zoom. Thank you.
Cloud is the Director of Behavioral Health at Beth Israel Deaconess, and you can send your questions, plymouthinfo@pactv.org. Today we welcome another new guest. It is Lee Filson, and she is the Executive Director for See Plymouth. Welcome, Lee.
Welcome. Thank you very much.
Lee, tell us how your organization has been responding to the COVID-19.
Well, we've been following what, if you look at old wars, back when they were bombing and Churchill was bombing the heck out of things, he was creating the Marshall Plan. And that's what we're trying to do in tourism right now, is come up with a plan that will help to dig us out of this mess once we get past it into the economic stage. I almost hesitate talking about that right now because I do realize that we're all going through so much. And right now, the most important thing is getting the right amount of PPE and doing all the right things and wearing masks and all of that. So with that in mind, what we've done at See Plymouth is we have begun a social media campaign that is on Instagram, Facebook. We are going all through the entire region with these ads, and they basically say, stay home and then see Plymouth. And we have a beautiful photos of Plymouth, like the rock, and it says the rock is forever. Or we have a number of different images like that so that people will try to keep us top of mind. And then for those of us who live here, we can look at those and somehow it makes us feel a little bit better, because some things really are static and they stay the same. And what will stay the same for us is the fact that we've got one of the best destinations out there to promote. But we also online on our cplymouth.com website, at the very top of the page, you can go to that and click on the left and find out everything that is happening with COVID with regard to tourism. And because this is the #1 industry in both the town of Plymouth and the county of Plymouth, we feel it's very, very important that those who are participating in that venture and those who are working in that area know exactly what's going on and how hard everyone is working for them. USTA is the United States Travel Association. They are the official travel association that works with the government. We're very lucky that they're working very hard to try to make sure that the tourism industry isn't forgotten. A lot of people think that tourism is just fun, but it isn't. It's actually one of the largest economic drivers in the entire United States, and especially for us here. So it's real important that we stay top of mind and keep promoting tourism and all it has to offer in Plymouth. On that page, you can also find out from the state what programs are available if you are in tourism. On the local level, what is going on. We try to also talk to you just about tourism in particular. And on the right side of the page, you can click on virtual tours. And in that section, you can watch many different videos about Plymouth and things that'll just take your mind off things. If you just really had so much of this that you're just tired of it and you want to go elsewhere, look at some of the things we have there. I also write once a week to everyone in the tourism industry and send out my COVID update. And in that, I usually share a lot of my observations having gone through Hurricane Katrina. And I think that it's so important to talk about those stages of grief, because we truly are going through all the stages of grief because we're grieving normal. It's not normal anymore. We're now going in to a new normal. But what I can tell you after having gone through that before is that we will get there, that things are never quite as bad as you think they're going to be. And all of a sudden, you come up with new creative ideas of how to kind of climb back up and get moving again. All of us are going to be poorer than we were when this started out. But all of us together are going to lean on each other and lift each other up throughout the tourism industry and throughout the town of Plymouth to make things better. The one thing that I did learn is that there is an other side to this. Imagine during Katrina that we had nothing to go back to. We had no infrastructure, buildings were blown away. One of the jobs that I had writing a column, the entire building blew away, not much less just that particular organization that I wrote for. We don't have that to deal with now, although in many ways, it's still just as bad because it's the entire world that is dealing with this instead of one town trying to dig out. So I guess that in tourism, what we've got to remember more than anything else is we've got to pull together. We've got to help each other. We've got to keep ordering from all the restaurants and going to them and supporting them, as Amy has so graciously, with the chamber, sent out all of the updates for who is available and what they're serving and what we can do to help them. But once we get past that, we're going to have to work very hard together to help the retailers and everyone else, which brings me to the closing thing I was going to say. And that is that locals are tourists too. And locals you usually account for about a third of the tourism industry. So whether or not you realize that, you do, because you also inhabit all the same places that the tourists do. So once we get a little bit past this and we can stop worrying so much about all of the other things, and we are starting to see a light at the end of the tunnel, just know that the tourism industry is there. We're making plans. We've got plans. We're working with the state on a campaign. We're working on local campaigns, and we will be ready to be there and help as we can.
That is Lee Filson. She is the Executive Director for See Plymouth. Lee and the other members of our panel will join us for our question and answer. You can send your questions to us live today at plymouthinfo@pactv.org. And as we do each week, we have a business segment, and Lee's being followed today by the Executive Director for the Plymouth Area Chamber of Commerce, Amy Naples. Welcome, Amy.
Hi, Steve. Thank you again for having me. Thank you, Lee, for that great advice, because that certainly rings true to our local businesses and our consumers, our residents. So first, I wanted to remind businesses of the Payroll Protection Program, which is the loan designated to provide direct incentive for small businesses to keep their workers on payroll. The SBA has resumed accepting applications this morning as of 10:30 a.m. from approved lenders on behalf of eligible borrowers. So far, the PPP has supported 1.66 million small businesses and protected over 30 million jobs of hardworking Americans. So with the additional funds appropriated by Congress, tens of millions of additional workers will benefit from this critical relief. The SBA is encouraging all approved lenders to process loan applications previously submitted by the eligible borrowers. Borrowers who need these funds should work with their banks as soon as possible. Do not assume your bank will process the application that you previously submitted. Be sure to contact your bank. That is very important. And of course, be careful of the scams and only discuss personal information with your trusted business banker. That's very important. the Chamber is actually hosting a webinar. It is called Making Sense of Small Business COVID-19 Relief Programs on this Friday, May 1st at 10 a.m. Robert Nelson, District Director of the SBA, will discuss the recent relief programs offered by the federal government, as well as strategies for small businesses that could consider maximizing the health of their entities and the benefits for their employees. So if you'd like to join us, you do not have to be a member to do so, but it's a great opportunity to learn more about the SBA programs. In addition to the webinar, we have our virtual networking opportunities, one on Wednesday morning at 10 a.m. and again on Thursday evening at 5 p.m. This is open to anyone, again. To sign up for notifications about the Chamber programs, you can visit plymouthchamber.com and just click on the sign up for emails. Be sure to stay in the know of all the Chamber is doing by visiting the Chamber's Facebook page, which is the handle Plymouth Area Chamber, and of course, our website, plymouthchamber.com. Thank you for the opportunity to provide the business update today, Steve.
Thank you, Amy Naples, Executive Director of Plymouth Area Chamber of Commerce. We're now going to go for our daily state update from Plymouth State Representative Matthew Muratore. Welcome, Matt. And let's unmute you, Matt.
Yep. Not used to muting myself.
Yes, go ahead.
Good afternoon, everyone. Great to have everybody on. First of all, I want to give a great shout out to our local fire and police. On a personal note, one of my daughters turned 14 yesterday, and there was a caravan of police and fire that they are doing this all throughout town for birthdays for kids, and had dozens and dozens of cars. And so we want a big shout out for what they're doing, and thank you for that. Also, just came back from the, well, my hair's a little messy. It's raining out today, and I just came back from the American Legion, and a big shout out to them and Roxanne Whitback, the veterans agent for the town of Plymouth. A great big success for the food drive that they just had this morning for veterans. So nice shout out to them. And again, thank you to Chris and Diane Hart for helping out veterans as well. Kathy Lenatra, the rep from Kingston, and I were there last Saturday, and today we were at the American Legion. So the veterans in our area are really getting a lot of support, and we appreciate everyone's efforts in that vein. So looking at the numbers from over the weekend, and these numbers are as of yesterday morning. So a lot more testing has been developed. There's been an additional 41,024 tests that have been conducted since we last spoke on Friday. So the total number of tests are 236,100 for a percentage of 3.4%. 3.4% of the Commonwealth has been tested. People in Commonwealth have been tested. Of those tested, 54,938, almost 55,000, or 23.3%, have been confirmed with the coronavirus. And that's up almost 9,000, 8,915 from when we spoke on Friday. The average age is still 54 years old who are getting this virus. There are of those that have received who have the virus, 3,879 are hospitalized. That's down a bit from what we had the other day. The hospitalization is at 7% now. On Friday, we had it at 8%, so that is dropping a little bit. And the average age of someone in the hospital is 69 years old with this virus. The deaths, unfortunately, went up again as well. Same percentage of deaths from nursing homes. Of the total deaths, 50%, 56%, as Karen was talking about, nursing homes are doing more testing and the like now. But 56% of the deaths have been through long-term care facilities. The total death count is now at 2,899, which is 5.3% of those that have been confirmed with the coronavirus, with the average age of 82 years old, and 98% of everyone who has passed away has had an underlying health condition. With regard to Plymouth County numbers went up by almost 1,966. Again, because testing is increasing, we will see these numbers go up slightly. Plymouth County has 4,495 confirmed cases, of which of which 233 deaths have occurred, which is less than 0.5% of the population of Plymouth County. With regard to hospitals, the hospital bed capacity in Southeast Massachusetts is still at 52%. The Commonwealth is at 56%. That includes the field sites as well. So we still have plenty of capacity in the hospitals, and as it was indicated by our folks on the panel, that we are in the surge still. So we expect these numbers to rise a bit. At BID Plymouth, as of yesterday, there were 49 cases of COVID-19 in the hospital, of which 6 were in the ICU. And they do have 79 ventilators that have been given to them by the command center of the Commonwealth. Interesting enough, the deaths are actually right down the middle for male and female. 1,447 males have unfortunately passed away, and females is 1,443. When looking at the trying to flatten the curve and looking at the reductions coming down, slightly a little bit over the weekend they have. On April 23rd, we had an additional 3,079 cases. On April 24th, we had 2,977 cases. On April 25th, we had 2,379 cases. And on April 26th, we had 1,590 cases. So it is slightly coming down, but we're going to need another week or two of solid numbers going down before we can actually think of opening up the economy. The governor is actually on as we speak. A couple of things that he has indicated so far, and Keane had brought this up about nursing facilities. There's going to be an additional $130 million provided through the long-term care facilities. And remember, every time we talk about long-term care, we're talking about nursing facilities, assisted livings, as well as rest homes. And there are 680 of those in the Commonwealth. So they will receive another round of $130 million. And they're also going to have some additional measures to assist them with testing and other things that they're going to be doing. There's also going to, part of this is going to be additional funding for staff, for overtime, and additional staffing, and more personal protection equipment for these long-term care facilities. And as we've talked in the past, as a healthcare, putting my healthcare hat on, this is the people that are dying the most are the people that are in these facilities, and they're not going out. So as Karen was mentioning about the mask, I know there's a lot of anxiety about people having to wear masks in public. I talked to a few folks this morning, and they think the mask is really to protect them. It's not. The mask is to protect other people, as Karen indicated. So trying to get that message out to people that you could be affecting somebody you don't even know you are. You may have it and don't even know it, and you could be passing on to somebody else who goes into one of these long-term care facilities that affects somebody that doesn't even go out. So we really need to still heed the warnings of our public health officials on wearing the mask for now. And I do think when we do open the economy that we will be wearing masks for some time to come. It's not going to happen overnight that's going to stop. So that will be part of the guidelines that will be coming out. And finally, I want to mention this. I mentioned this last week as soon as it came out, but it really hasn't got a lot of play in the media. And a lot of people have been reaching out to my office about this, and myself and others. It has to do with providing protection for renters and homeowners during this emergency. And basically, it says that the evictions are prohibited, as well as terminations, and there cannot be any notices sent to terminate your rent if you are a renter or you lease as a small business owner. With mortgages, you have to contact your lender, as Amy was talking about the PPP. You have to contact your bank. Same with this. It's not going to happen automatically, but your mortgage, you can have a forbearance on your mortgage for paying for right now up to a certain point. And then the forbearance, you still have to pay it, but it could be put on the back end of your loan document. So it wouldn't have to be paid when this emergency is over. So the key here, though, is you want to make sure you get to your lender as a mortgage. If you have a mortgage, to ask for this, you have to initiate it. to ask for this forbearance for now because of this coronavirus. And again, renters and small business owners, if you are renting, nothing can happen to you at this point, but you're going to have to pay it back at some point. So just keep that in mind. And that is the update. I'm just checking to see if there's anything else from the governor. Yeah, that's the update for right now, Steve.
Thank you, Representative Matthew Muratore, providing a daily state update. Both he and Karen Keane mentioned about masks and equipment, and our Beth Israel Deaconess Hospital campus in Plymouth has told us that in their update today, hospitals and healthcare facilities continue to struggle with adequate stocks of PPE equipment, which would include face shields, face masks, and gowns. But the Plymouth campus states that their stock levels are adequate due to a system-wide sourcing of PPE and new N95 mask sterilization guidelines for limited reuse of N95 masks. The Plymouth campus is part of a 13-hospital Beth Israel Lahey health system, and the Plymouth campus has the ability to share and access medical supplies and equipment as needed, including ventilators, PPE, medical supplies, and pharmaceuticals. And looking forward to tomorrow's lineup, we have Christopher Smalley. He's the Senior Director of Marketing and Communications at Beth Israel Deaconess Hospital in Plymouth. He'll be joined once again by Chad Hunter, who's the Harbor Master for the town of Plymouth. And each Tuesday and Thursday, Stephen Cole, the Executive Director of Plymouth Regional Economic Development Foundation, join Ken Tavares, Matt Muratore, and me for your daily update. And at this time, we're going to go to our question and answers. You can send them to plymouthinfo@pactv.org. And we have a number of questions today. And the first question goes to Ken Tavares. Ken, the question has to do with parks. And the viewer says that he understands that the current order for parks is that they're closed to groups of people. And he thinks that it's not individuals or 2 to 3 people, which he understands can walk in the parks and the trails. But he's concerned that there have been tagging of cars that park within the areas of the parks. They're not blocking gates or roadways, but they're getting blue tickets saying avoid the fines, parks are closed to groups, but not individuals that are respecting social distancing in parks and trails. He'd like you to elaborate a little more on the parks closings and asking whether or not there'd be any changes to that.
Well, I think the first thing that we need to do is to check and see why the tickets were issued. And I will do that when we get off the program today and report back to everyone tomorrow. The parks are closed. This is something that can be looked at again, and we'll have some discussions with the town manager as to seeing if there are any additional areas that it could be opened up, but they are closed. I noticed on Saturday, it was a beautiful day and no one was on Plymouth Beach, so the protocols are being observed. But this is something that needs to be continually reviewed, and I will do that a little later today.
Kenneth Tavares is the chair of the Plymouth Board of Selectmen. Our next question goes to Karen Keane. Karen, you've given us some information regarding testing, but the viewer says, again, for clarification, what are the number have been tested in Plymouth? What are the negative numbers of those we tested, and how many have recovered?
Okay, so we have had 177 confirmed cases in Plymouth. We have had 41 that we know of currently that have recovered. That number, I assume, is much greater, but because of the contact tracing program, we won't know those numbers until those cases are complete. But I believe that number is much greater than 41. And we have had 6 people pass away from COVID-19.
Karen Keane is the Director of Public Health in Plymouth. Next viewer question, I'll first go to Matt Muratore, although it's a business-related question, and I don't think we have the answer, but I'll ask you. And the viewer writes, what is the status of non-essential businesses being able to open after May 4th? Matt.
Well, the governor just came out and indicated that he's going to make that decision later this week. What he's waiting for, and what we're all waiting for, is the hospitalization numbers and to see how that trending is going to go. So he's hoping to make that he will definitely make that at some point this week.
Thank you. That's Representative Matthew Muratore answering question from a viewer. Your questions can come to us now live at PlymouthInfo@pactv.org. Each day we go back to each of our participants and ask each of the participants for your closing thoughts, or what takeaway would you like our viewers to remember from today's presentation? And we're going to begin with Chris DiBona. Chris, again, is the Director of Clinical Performance for Brewster Ambulance. Chris, what would you like our viewers to remember today from what you've had to share with them?
I just want to say thank you, and thank you for tuning in. And also just let them know, if you need emergency medical services, don't hesitate to contact 911, and we'll guide you through whatever process is needed. We'll keep running the calls as much as they come in. So thank you for your compliance, and thank you for the opportunity to serve the community. And if you need anything, please reach out.
Thank you. That was Chris DiBona. He's the Director of Clinical Performance for Brewster Ambulance. We're going to go back to Karen Keane, Director of Public Health, Town of Plymouth. Karen, you've been with us before, but today things have changed. They're being updated. What should we remember?
Thank you, Steve. And again, I want to thank everyone for all of their efforts. Everyone out there in the town of Plymouth, residents and visitors, we thank you for what you're trying to do to keep everyone else safe. Continue, practice social distancing. It is so critical. Remain 6 feet apart, continue hand washing, wear masks, only go out when necessary. Check in on elderly neighbors if you have them to make sure that they have everything that they need. And finally, one additional note with regards to the contact tracing program. People will be calling people who are positive with the COVID-19. They'll be giving a list of people they've come in contact with. The contact tracing program reaches out to those people to explain to them what they should be doing moving forward. Please answer the phone. It's important that we get this information. They'll either, on caller ID, will either say COVID-19 or it could say contact tracing. But the one thing I want to stress here, which is so vitally important, we will never, ever ask anyone for their social security number. So like anything else, there's some fraud. And there have been some people who have received phone calls and they've been told that they're calling to get information from them because they came in contact with someone who was positive with COVID-19. And that is not the case. No one will ever ask you for your social security number. So I just want to make sure that everyone understands that. So please pick up the phone if you see contact tracing or COVID-19 tracing on your caller ID. But if it's anyone else calling you, asking you information about people you might have come in contact with, and they start off with, "Can I have your social security number?" Just hang up the phone or contact the police. Thank you.
Karen Keane is the Director of Public Health, Town of Plymouth. We're now going to Sarah Cloud, who is the Director of Behavioral Health and Social Work at Beth Israel Deaconess in Plymouth. Sarah, thank you for joining us once again. You'll be joining us each week on Mondays, and we appreciate all that you and the hospital have been doing to help us through this coronavirus crisis. What do you want us to remember today?
I want to thank you for the opportunity to talk about emotional PPE as we collectively grieve losses that have already occurred, losses that are still being anticipated, and our general loss of safety and normalcy. I'd like to wrap up with a few suggestions on how we get through this together. I'd like to suggest that we pause throughout the day to check in and reflect on how you're feeling. You can name that feeling. If you can identify what may be causing it, this really helps us move through emotions. We're less likely to get stuck. Try to find the right balance between feeling and distracting yourself. It can be very healing, even though it doesn't feel that great, to sit with the distress and feel your way through. But it's also very exhausting if you do this 24 hours a day, 7 days a week. So find the right balance, and please be careful not to numb your feelings with drinking, smoking, eating, or binging. Instead, try to stay present and focus on what you can control. Be patient with both yourself and others. Remember, it is okay not to be okay all the time. Engage in acts of self-kindness, such as going for a walk or finding humor. And most importantly, stay connected by reaching out to others. We will face this together. As Leah said, there's better days ahead. Thank you.
Thank you. That's Sarah Cloud. She's from Beth Israel Deaconess, Director of Behavioral Health and Social Work. And at this time, we're going to go to Lee Filson from C. Plymouth. Lee, this was your first time with us. What do you have that you want us to remember today?
Well, first of all, my deepest condolences to everyone who has had loss and people who they're very much worrying about right now with COVID. I wish the best, and prayers are being said for you. As far as tourism, I will let you know that generally what all of the polls are telling us and all of the behavioral surveys that we're looking at tell us is that after a pandemic, generally tourism and business in this community will start to go up within 3 to 5 years. This year is going to be a tough one, but it doesn't mean that we can't work together to get through it. Next year, we'll start to see things rise, and by year 3, things will rise fairly quickly, at least where tourism is concerned. We're working very hard to do everything possible to move those numbers up as quickly as we can. And I guess the last thing that I would say is something that I learned from the experiences that I've been through is remember that there is speculation and then there are facts. So every time you start to become totally anxious about something, think about whether it's speculation or if it's a fact. And if you stick with the scientists and the medical community and listen very carefully, that will help you to get through this much more quickly. Thank you.
Thank you. Lee Filson, Executive Director for C. Plymouth. And our participants are reminding us about the fact that there are resources available to you, that many people are experiencing a lot of stress and upset as a result of COVID-19. I also spoke to a family member this morning who just lost an ex-spouse due to alcohol consumption during this COVID-19 pandemic. And the hospital reminds us that in the event that a patient requires emergency surgery or hospitalization, the hospital has ample bed availability here in Plymouth. And this is a direct result of suspending elective surgical procedures and treatments and tests during COVID-19 pandemic. So if an individual needs emergency care, they should not hesitate to come to the emergency department in Plymouth. There have been numerous safety procedures that have been implemented to minimize exposure to COVID-19 positive patients. At this time, we're going to move to Amy Naples. She's the Executive Director, Plymouth Area Chamber of Commerce. Amy, you've been with us each Monday, Wednesday, Friday. What is your takeaway for today?
Well, Karen shared some great information regarding the masks and the importance of wearing them. And I want to let viewers know that we have a list of local businesses who have masks available for purchase. They are listed on our website under the COVID-19 page. And certainly we understand this is an extremely challenging time for businesses. And I want everyone to know we are here for them. All of my colleagues on the panel today, great leaders in our community, we are certainly here for you. The Chamber team is working hard to assist the small businesses every day. So if there is anything we can do to assist or help, even just some advice, please reach out. We are here for you. There are resources available to small businesses, as Steve mentioned. So be sure to reach out to trusted organizations and leaders in our community to learn more about those opportunities. And as always, I encourage you to support your local businesses. They need you. Distance socially and support locally.
That is Amy Naples, and she is the Executive Director for the Plymouth Area Chamber of Commerce. We have one additional question that's coming in, and the viewer says her friend, she's helping a friend who recently was at BID Plymouth friend called an ambulance on Friday because she had a stroke. She was admitted and released. She returned yesterday for more tests. It's her second trip to the hospital. She said they tested her twice for COVID and both were negative. She told that the medical staff said she's having TIAs as a result of her previously having COVID-19. And she was asked, did she have any contact tracing? And they did not. She also asked for a plasma donation. They did not. So she's not asking what happened in a specific question, but the question is, what are the policies in Plymouth relative to both contact tracing and plasma donations from recovered COVID patients? Karen Keane, I don't know if that's something to which you can respond at this time.
Well, with the contact tracing, we can, I can certainly let people know that that comes from the individual who's tested positive for COVID-19. So once the person's tested positive for COVID-19, someone will reach out to them and will request what's called the close contact list, meaning in the past 48 hours, who have you been closer than 6 feet to for longer than 15 minutes? That's the contact list. Now, as far as the plasma donation, I don't know anything about that, Steve.
Thank you. We'll get back. These questions are coming in live, so we're trying to respond to them. But we can tell the viewer, we do have the drive-through testing site in Plymouth at BID Plymouth drive-through. It's open by appointment only, but it's for hospital employees, first responders, patients of local physician practices, and symptomatic employees of long-term care facilities only. The testing site was made possible through a relationship and collaboration with the town of Plymouth, and the hospital is grateful for the town bringing together the various departments to make the site a reality. It's located in the hospital's parking lot B, breast center lot. Any decision to expand the drive-through testing site to the general public will be communicated to the media. And again, it includes patients of local physician practices. We're going to go to Matt Muratore. Matt, what would be your closing statement today?
Thanks, Steve. And to answer the question of the plasma, they really should reach out to their primary care physician to really ask that question. Just as a reminder, there's a lot of ways to help. Karen Keane mentioned one of them, giving blood. Giving blood is such a great need at this point. And so, as she said, if you can give blood, please do so. It's done safely, and it's in such need. And again, people are looking for things to do, looking to help. You know, we still have the COVID-19 relief fund if people want to donate to it. There's all sorts of ways to volunteer. As Karen mentioned, the contact tracing, they're looking for people to help with that contact tracing, which is greatly needed at this point. They're looking for folks who have personal protection equipment to either sell or donate still. And they're looking for people that want to work at these temporary care sites as healthcare employees. So we encourage people to stay informed and go to the mass.gov /COVID-19 website, or ask questions at 211. Get text alerts through COVID MA to 888-777. There's also a Spanish version of that as well, COVID MA ESP to 888-777. And as Karen indicated, bowie.com /mass for health questions. Yes, stay calm. We're in the surge. We will get through this. We will get out of this. And stay at home as best you possibly can. Social distance, wear the mask. And remember, the more we come together by staying apart, the faster we'll get back to the people we love and the things we love to do. So I want to thank you, Steve, again for doing this, PAC TV. And we really need to thank all those folks in the healthcare field that are helping us physically with our health, and all the other people that are out there that are helping with the health of our economy, that are working in these essential jobs. So our hats off to them. We thank them.
Matthew Muratore, Plymouth State Representative. We thank Matt, and all the members of our panel today include Chris DiBona, the Director of Clinical Performance at Brewster Ambulance, Karen Keane, the Director of Public Health, Town of Plymouth, Sarah Cloud, the Director of Behavioral Health at Beth Israel Deaconess, Lee Filson, Executive Director, C. Plymouth, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce, and we now circle back to the Chair of the Plymouth Board of Selectmen for your final thoughts. Ken Tavares. Ken.
Thank you. First, thank you to everyone on the panel today. You have brought in very interesting aspects of your own job and how it's impacting all of us in the community. We thank you for doing it. Also, I think we need to start to recognize that we're battling this virus on two fronts: the economic and the human. And certainly, I think we have to take care of ourselves and our bodies as human beings first, so that we can, then go ahead into the economic aspects. As people have mentioned today, there are, and Lee said it very well, we are looking and planning in the background right now, trying to do this at the same time as we're fighting the disease itself. There are going to be a number of very serious decisions that are going to have to be made in the next few weeks, and many in the community will be called upon for their expertise and advice. We need to continue, as everyone has said on this panel today, to keep the distancing in place, the masks, and staying at home. It is proven that by doing this, we are defeating this virus, or gaining a good hold on it. We must continue to do that. The economic side of the picture is being investigated fully. And as I said, many people in this community will be involved in that. We're concerned about our businesses and getting back to what may be a new norm. So I just ask that we all have patience with one another and be kind in offering advice. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And as Ken has said, we're trying to balance our panel each day. We always have an economic component, but we're also trying, as Ken said, to be aware and respond to the human aspects of the coronavirus response. Tomorrow, we're going to be joined by Christopher Smalley, the Senior Director of Marketing and Communications at Beth Israel Deaconess Hospital, as he's going to be joining us each week on the program. A return from Chad Hunter, the Plymouth Harbor Master, and Stephen Cole, the Executive Director, Plymouth Regional Economic Development Foundation. So I'd like to thank all of you for joining us today. I'm Steve Triffletti, Plymouth Town Moderator. Good day and thank you.